Thank you, Mr. Chairman, and appreciate you all participating in this important hearing. Obviously, we want to be proactive to help Americans stay healthy, to improve their quality of life, to lower their medical costs, and to also save taxpayers money. And it's no secret that Medicare has a solvency problem, and diabetes and obesity are some of the main drivers. Nearly 1/3 of Medicare spend is attributable to diabetes population, and as the obesity rate in the U.S. continues to rise, so will the rate of diabetes. At nearly $300 billion, diabetes currently accounts for 1/4 of all U.S. healthcare spending. The Congressional Budget Office has identified several options to rein in costs. However, many of these could be harmful to our seniors already suffering from inflation. Promising new drugs and medical devices such as GLP-1, Ozempic, and continuous glucose monitoring certainly should play a role in reducing the risks diabetics face and lowering costs to both individual finances and the federal government. However, other innovations are happening in the healthcare space to treat diabetes, obesity, and other diet-related diseases. So again, people can live longer, healthier, and happy lives. One of these innovations is medical nutrition therapy. MNT is provided by a nutritionist with the goal of assisting a patient choose and buy foods that are healthier, manage complex medical issues like diabetes by creating sustainable behavioral changes. In a nationwide representative study, a large healthcare provider showed that $130 per member per month savings, or nearly $1,600 per year, from giving members over 65 access to this type of nutrition guidance. But today, in Medicare, only diabetes and renal disease are covered, while obesity, prediabetes, and other chronic illnesses which lead to diabetes related to poor nutrition is not. Yet, if we look in the private payer space and in Medicaid, we are seeing MNT coupled with tools to stretch people's food dollars in ways that allow them to meet their diet, cultural, and religious needs, saving costs to patients, saving costs to the system, and improving health outcomes. My staff recently met with a company that works with private payers, Medicare Advantage plans, and Medicaid MCOs to deliver telenutrition services to patients. And they have data right now that shows MNT patients lose an average between 4 to 6.5% of their weight and continue losing weight after year 2 due to behavioral changes. Mr. Ippolito, should Congress press entities like the Congressional Budget Office to review this data to help us understand how we can leverage nutritional programs as a strategy to provide relief to those at risk of diabetes, as well as to taxpayers continually paying for it?
Well, I guess my short answer is that I think Medicare could use any budget help they can get. So if you've got a proposal that could save money, then it certainly seems like something CBO should look at.
Anyone else want to chime in before I move to my next point? All right. Well, during my time in Congress, I've been advocating and pushing to require, at least in part, or incentivize SNAP recipients to purchase healthy foods. And I'm joining Congressman Garbarino, also of New York, on an effort to end a ban on purchasing prepared and hot foods with SNAP, which would be, I think, a big step. Dr. Herman, how would these reforms in the SNAP program affect the rates of obesity and diabetes among recipients? And do you believe that this would play a role in reducing government spending on obesity-related chronic conditions?
So it's an excellent question. I have to say I am not an economist or an epidemiologist, so the impact of changing policy on spending is really outside of my expertise. What I would say is that lifestyle management is always a part of diabetes and obesity care and has demonstrated benefits.
Yeah, and I guess that really is, at the end of the day, the real question is, will it help people improve their health? Will it lead to healthier options for Americans who are SNAP recipients, so they can make these choices? I mean, to not allow for prepared or hot food, I think, is a mistake that probably pushes people into a different direction, or some of these preserved foods and stuff like that. Anybody else would like to respond?
Yes, Ms. Malliotakis, I would say that anytime anyone has an opportunity to have a healthier diet, I think that they would be able to take advantage of it. And I think with the programs that you are proposing, that even started at younger ages. The younger you start in these programs, the younger you are exposed to healthier foods, the more likely you are to continue that into adulthood. And prevention, I think, is really the key. I think that prevention of obesity is definitely something that can be beneficial from these programs.
Great. Thank you both.